One of the pieces of information that's really important to people with cancer is their genomic information. It's really important to patients that they have the opportunity to actually have some control over how their treatment and management is going to unfold, and genomic sequencing helps with that because it puts them in the driving seat. But it wasn't until I had my own cancer diagnosis that I had a slightly different understanding of how those things could come together to make a difference. I had a family history of cancer. So I had some questions for my oncologist around, were there any connections in relation to those things? One of the things that she then organised for me to have was some genomic testing done. And at the time, it also didn't occur to me that perhaps there was another use for that information. Understand a bit more the power, if you like, of what genomics can do. That testing is kind of wasted if we don't make use of it.
I'm Brian Chan, a medical oncologist here on the Sunshine Coast, and I specialise in thoracic and head and neck oncology. The Rare Cancer Care and Research Fund was set up late last year in 2022 here on the Sunshine Coast University Hospital by mainly two of our patients who actually have a rare cancer themselves. And it's through their determination and generous donations that we've been able to set up the fund and grow our collaborations. Both of the patients said that there was a lack of information and a lack of guidelines for people with rare cancer. How devastating that can be to be diagnosed with any cancer, but particularly one where your doctors are saying there are no clear guidelines or treatment plans. And so if we can change that and improve any outcome for any person, I think that's a worthwhile cause. Research is important and care is also important. So by doing both, we're trying to really make a difference for people. And for me, as an oncologist, this is what I get up in the morning for. It's to make a difference in people's lives every day.
Being part of the Rare Cancer Care and Research Fund makes me feel like I can actually make a difference. There's something that I can do that's actually going to have an impact, not perhaps for me, but for other people.
You're not just donating money, you're contributing hope. You're contributing hope to patients, contributing hope to families. I'm hoping that people with rare cancers in the future will have genomic sequencing as standard for them, will have availability of better treatment options as a result, and ultimately improve survival for all patients with less common cancers.